everyone, it's me again, future Dr. Zoe, and I know it's been a while, but I'm kind of excited to tell you that I'm almost there. I've about just a few more months left till I graduate in med school, and I've been having such a great experience. Well, could have been better if we weren't experiencing a pandemic right now, but nonetheless, I've been able to experience a lot of things during my mixed online and face-to-face clinical clerkship. And today's story that I want to talk about, as shown by the title, is my first experience in the OR, or my first ever surgical procedure assist. So it's really kind of exciting, but first of all, I want to say how grateful I am to have such understanding mentors and seniors who are also understanding and kind when they realize that people in my batch really have no experience. Came from second year med, so we never really got to practice any of our suturing skills or anything, and yet they were so patient with me, and I'm so grateful for that. So the story was, I'm actually kind of fortunate that I was able to be the one who admitted the patient. So I was able to interview her, get to have a history of her, and then I was able to assist in the procedure the next day, which usually doesn't really get to happen that much because of the scheduling conflicts and everything, and you're just really lucky to have any encounter right now at the hospital ever since COVID happened, right? But nonetheless, it was a very routine procedure. It was a laparoscopic cholecystectomy. So what did we do? So it was interesting. So obviously when I was doing the history taking, it was so cool that everything that you read about is actually in front of you right now. Like, this person had chronic postprandial colicky pain. This person always she had abdominal guarding when you're doing all of those tests and everything, and I was like, whoa. I don't know, like, I guess as a medical student, when you're not just reading things anymore and you're actually seeing them, I feel like it sticks to you more. Anyway, so after that, let's talk about scrubbing into the OR. So unfortunately, we never had our trials or simulations that we have in our medical school. Like, in our building, we have simulation labs that teaches you how to properly scrub in. So of course, me as a clerk with zero knowledge about scrubbing in, and I should have done my homework and watched a video on how to properly scrub in. The residents were like, okay, who's scrubbing in? We were all looking around, and I was like, me? I'll scrub in. I know the case. So I scrubbed into the procedure, right? And okay, I kid you not, like, their gloves placed on the table, and then I didn't know how to properly wear it, and I'm so grateful that the nurse was so kind and she helped me. The scrub nurse, she was like, okay, you're wearing sleeves, okay, so your sleeves, they cover up to your fingers, so nothing from your body is outside of the gown that you're wearing, right? And then when you wear the gloves, you have to slip in one of your hands into the glove, and then I don't know, it was so hard. Like, I couldn't understand how to properly wear them because you're not allowed to touch it. You're only allowed to use your sleeves, right? So it was so hard to get any grip at all in putting the gloves. But eventually, somehow, I was able to put on the gloves. But oh my god, guys, it was so bad. Like, it was the kind of the fit of the gloves. I had leftover parts of my glove particle just dangling about. I swear, if I did that to my arms, you'd just see the parts of the gloves dangling, and I didn't want to look stupid, I wanted to okay, confidence. You have to pretend you're confident, at least to the people around you. So I was like, okay, how can I fix this? Literally, the sleeves of the gown were at the tip of my fingers here, right? And then the gloves were that dangling over, and I was just slowly, since as a third assist, you don't really do much in the laparoscopic procedure because there's a second and first assist that are holding to the other gadgets in a laparoscopic cholecystectomy. So during the meaty part, or the important part of the procedure, I'm there just with my hands on the OR table, just watching and observing, close hand, first hand, right? So during that time, I was slowly pulling my sleeve back, so that the gloves will come closer to me, so that the gloves will be a proper fit, because when they told me that I'll be the one who will help in closing the patient later, that I'm going to do suturing skills, and I was like, I can't suture if my gloves are dangling up and about. So yeah, I was pulling it slowly, and the scrub nurse beside me was kind of giggling at what I was doing, giggling at my struggles. But anyway, so as I was doing that, I was pulling slowly. I was eventually I had the gloves on properly, and I swear that then I had a next problem, right? Because the procedure is kind of long. It's like about an hour. So my next problem was my face shield. Oh my goodness, I need to buy a proper surgery face shield. But I was wearing a new face shield that was obviously had to be sterile. And I could feel it just slipping from my face, like it was here already at the tip of my nose. And you're not allowed to touch your face shield. You're not even allowed to use like your arms to adjust anything because your whole upper body is supposedly sterile. So you're not allowed to touch anything that could be unsterile. Not even like you can't touch, like really you can't. You have to ask help from others or something. That's why usually when surgeons are sweating or they need stuff adjusted, they ask some of the nurses to adjust it for them, right? But I'm just a measly clerk. How am I gonna ask the nurse to help adjust my face shield? I was so shy. I was like, okay, I don't have the confidence to ask the nurse to help me and put my face shield up properly, right? So I was just now I made it with my gloves. I can make it with my face shield. So every now and then I would just look up and wiggle my face trying to get the face shield closer to my eyes. And yeah, it was a struggle, but at least it kept me, sort of distracted. I didn't think about how long I was standing anymore, but yeah, it was cool. Anyway, so now the interesting part of the procedure started. So because it takes a while to actually open up the patient, like they don't show you these stuff previously. Like they show you already like the cool parts of the surgery usually when you watch surgical procedures, but there's a lot going on before you actually open up the patient. Like I was so surprised that in a laparoscopic, not surprised, but surprised to see it myself, that they're really digging into the belly button. Like, that's where they put the camera. So I was like, whoa, they're opening that up. And it took a while to kind of open that up to properly place the camera in. And obviously when you're starting the procedure, you're like looking around. They had to look for adhesions, see if there was anything that could be preventing the surgery from being successful, right? So they noted down everything. They looked around the abdomen before actually starting. And I was really grateful because the attending physician on the case was really, like, he was really taking the time to teach us like the proper structures in the proper way. And because it was like a 2-in-1, because the standard procedure now is to actually label the parts of the callow triangle so that you make sure that you don't make any mistakes, right? So when that was happening, we were like labeling all the parts. He was making sure that this was the cystic artery and everything and all of those stuff, and it was cool. Like I was getting my review of anatomy with a real person, and it was really interesting. And to watch the procedure actually happen was like, it was cool, like you kind of get excited for the future. And I was like, do I want to be a surgeon? This is what I see myself doing. Like those are the questions I was seeing, right? And I don't know, it was really good. And our attending physician was really talented because he was able to do it really fast and without any complications that happened during surgery. And it was interesting. Like it was cool to watch it happen from two angles. And I was like, wow, this is how it works. This is how the OR works. Okay, now let's jump into my experience. So when finally the surgery was over, I swear I had so many bloopers, guys. Like I don't know, I feel kind of shy, but you have to have experience. Even if you don't know much, just trust in your seniors to help you and guide you, because honestly we really don't know everything in the world. Like we have our seniors there to help us and guide us. We do our part to study the theoreticals, and when it comes to the practicals, they're there to guide us. So when they asked me to do the suture, I was like, I've read about it. I've never done it before. I haven't practiced it because the suturing kit I ordered hasn't arrived yet. So the resident was kind enough to guide me. So she showed me first how to do the subcuticular stitch, right? So she showed me first how to do it. And then as I was doing it, she was telling me how to properly hold the instruments because I was so nervous. Like, of course, I probably knew how to hold them properly maybe beforehand, but I had my anatomy dissection and all, but I was like so nervous. Like, I don't know why. Like, maybe because it was actually a real person this time that I was going to perform a suture on, that I was forgetting how to properly hold things, or I would I don't know, I froze a bit, but I was like, Zoe, you have to focus. You can do this. You can do this. You have your senior there, and you're just closing up a hole. You're closing up a little hole. You don't have to worry about it. You're in the skin layer. They did all of the hard stuff already. So I was like, okay, we can do this. We can do this. And so that was me. I was putting the thread in and everything. And when I was actually like, putting the needle or the hook, looks like a hook, into the patient. Like when I was actually about to put it, I was like, oh my god, I'm actually going to be part of a person's real management. It was insane. And so I was able to do that. I was able to perform the stitch, which took me like, I don't know, a stitch that took my resident only 1 to 2 minutes to perform took me like 5 minutes to do because of my panic and worry that, am I in the correct layer? Am I doing this correctly? But eventually I was able to do it, and it was so good. And because of that, I kind of encouraged others to like, just don't be shy. Ask if you can do stuff. They'll teach you. They'll guide you. Our residents are awesome. And so yeah, I sound so excited. But anyway, that was my first surgical assist ever. Unfortunately, due to the limit of patients that are going to procedures and the limited days of hospital experience, that has been my only surgical procedure that I was able to fully assist in. Nonetheless, I'm grateful for the experience, and I hope to be able to tell you a bit more of my other stories. Unfortunately, I can't really film that much because you have to respect patient privacy. There are some angles I can show, but I can't really show a lot of videos because, yeah, data privacy and all that. But anyway, I thank you guys for being here. If you're still watching this video, I hope you give it a like, comment, and yeah, I hope you guys are all doing well. See you in my next video.
And if you're not home, I'll be happy for you.